Hi everyone, good evening.
Good evening, sir.
Yes, Andrew, you are having some doubt, I think. Your face is showing some doubts. What is your doubt?
Sir, brief, sir. Sir, I heard about the term COPD, sir. So can you please elaborate with the specific term?
Anyone know? Oh, we'll see that. So, he told about the COPD. Do you know what is the explanation of that COPD or expansion of that COPD? It is known as chronic obstructive pulmonary disorder or disease. Okay, so this is COPD. It is a progressive lung disease. Mainly, that COPD will affect the lung. Okay, so characterized by chronic inflammation and airway obstruction. So the patients who are having this COPD, they will be affected in there will be difficulty in their breathing. Okay, mainly affects the lungs. So airway obstruction will be there, and impaired lung function will be there. So this COPD is a major cause for morbidity and mortality worldwide. Not only in India, worldwide, it is one of the diseases that causes morbidity as well as mortality. So there are so many types of COPD. First one is chronic bronchitis. So any letter that ends with the ITIS means it is known as inflammation. So here chronic bronchitis. So there will be a inflammation and irritation of the bronchial tubes, and there will be excessive mucus production will be there. Okay, this is chronic bronchitis. There will be inflammation in the bronchial tubes and irritation, and that will lead to a excessive mucus production. Then emphysema. Here, what will happen? There will be a loss of lung elasticity and restriction of alveoli that lead to breathlessness. We will find some difficulty in breathing. Okay, it is the reason for that one. The lung lost its elasticity, and there will be destruction of alveoli that leads to breathlessness. That is difficulty in breathing. Then third one, you might have heard about this term, asthma. Okay, and if you are going anywhere, if you inhale some dust particles, then immediately you will be the victim for this asthma. So this is characterized by chronic inflammation and airway obstruction. There will be also some difficulty. Asthma patients, there will be some difficulty in their breathing. Okay. So how will you treat this COPD? By using. So there will be a constriction and inflammation in that alveoli as well as that bronchial tube. So it will be treated with the bronchodilators, corticosteroids, and phosphodiesterase 4 inhibitors. These are all the some drugs. Okay, bronchodilators, corticosteroids, and phosphodiesterase 4 inhibitors. So as we asked about any new drug, so I have taken one drug that is roflumilast. That is a phosphodiesterase 4 inhibitor. So this is the structure of the phosphodiesterase in 4 inhibitor. So you will find here there will be pyridine nucleus will be there, that it is connected by this CONH, that is a peptide bond, and it is again attached to a benzene ring. Then it will be a difluoromethoxy group, and this is the ethoxy cyclopropane, OCH2, then cyclopropane will be attached. This is the structure of roflumilast. So what is the mechanism of action of this roflumilast? Normally ATP will be, you know about the ATP, that is adenosine triphosphate. It will be converted to cyclic AMP, adenosine monophosphate. Further it will be converted to inactive cyclic 5-cyclic AMP, that is inactive. Here our drug, that roflumilast, will act on this conversion, that is cyclic AMP will be converted to 5-cyclic AMP. So here that this cyclic AMP that will increase in immunomodulatory and inflammatory cell. So there will be decrease in the immune as well as inflammatory activity there will be relaxation of airway smooth muscle and suppression of inflammatory cell function, then inhibition of airway smooth muscle proliferation, followed by modulation of activity of pulmonary nerves. This is the mechanism behind that, this phosphodiesterase 4 inhibitor, especially by the roflumilast. So how will you synthesize? As a chemistry teacher, I have to tell what is how you will synthesize this roflumilast. The starting material for this one, you can see the structure right here. The 5-hydroxy 4-difluoromethoxy OCH F2 will be there. Here it is CH, it is F2. So here hydroxyl group is present, and this one is benzaldehyde. So this will be treated with the bromomethyl cyclopropane. So this cyclopropane that has been attached to a CH3 means it is a methyl cyclopropane. So one hydrogen is replaced by the bromine, so it will give the bromomethyl cyclopropane in presence of potassium carbonate and acetone and nitrogen. There will be change in that structure. Can you able to see any change here? Can you able to see any change here? What is the change? So here hydroxyl group is present here. So it will take the bromine that will be eliminated as hydrogen bromide. So it will be attached as a OCH2 cyclopropane will be attached here. Then this is followed by treatment with the acetonitrile and water molecule. What will happen? Here you will observe the change. So this is a CHO and this will be converted to COOH. So aldehyde will be converted to carboxylic acid. So this is followed by the treatment with the sulfonyl chloride. This sulfonyl chloride that in presence of dimethyl formamide and toluene, the COOH will be converted to COCl. This is followed by treatment with the, here you will observe that one, 1, 2, 3, 4, 5. Okay, so 5 amino, 3,5-dichloro-pyridine. That will be added here. It will be converted to sodium salt. That will be added to give the product roflumilast. So roflumilast will be formed. The starting material will be 5-hydroxy 4-difluoromethoxy benzaldehyde. Followed by treatment with the bromomethyl cyclopropane, acetonitrile, and treatment with the sulfonyl chloride. Then that 3,5-difluoro-4-amino-pyridine will give the product roflumilast. I hope that I have answered your question, isn't it, Andrew? Okay, thank you.